here at TV5, we aim to help you answer your health questions today in Medical Moments. Covenant engages our community and its patients through patient and family advisory councils to make the hospital the best it can be for your future patients. Its future patients, I should say. Here to share information about the Patient and Family Advisory Council at Covenant, Kristen Tenbush. Good to see you again.
Hi, thanks, Craig.
Let's talk about this this morning. What is Patient and Family Advisory Council all about?
Well, healthcare is in a really exciting time right now. We're actively engaging with our patients to improve healthcare. So a Patient and Family Advisory Council is a group of former patients, a lot of them are current patients, and they sit in a meeting with us, with staff and leadership to help improve the future of healthcare.
That's excellent. So what are some of the things they talk about? How long has this been going on?
Well, we've had our main council going for about 9 months, and a lot of the things that we talk about, I mean, we've reviewed billing statements to make them more patient-centered. They've helped us design whiteboards that go in our inpatient rooms. They've helped us with our discharge planning process. They've done walkthroughs of the hospital while we're doing renovations. And so they're helping us make decisions while we're actively doing these things versus looking at it after the fact and asking them. So they're helping us through these processes.
I would imagine there's been a great reaction to this, that people really like this.
Oh, absolutely. So we have 8 advisors right now. We're working to recruit advisors for our Cancer Care Center as well. So we're starting sub-councils because it's been so successful. And what the advisors tell us, I mean, they're volunteers, and they're telling us, thank you. Thank you for allowing us this opportunity to make a difference in the community. When they come into the ER and they see the differences that they've made, something that they've touched, a project, they're like, wow, what an opportunity.
So if you want to be an advisor, how do you go about doing that?
So you could call me directly. Okay. I'm the Patient Experience Administrator at Covenant, so I handle all of that stuff. You could also go on to covenanthealthcare.com /PFAC, so PFAC. And there's 3 applications on there right now. One for the Core Council that we've had going for some time, and there's another one for the Cancer Care Council. So we do have 7 advisors recruited for the Cancer Care. We're starting that in about 2 weeks. So we're really excited, but we're still looking for more. And we're also starting advisory councils in our physician offices. So we have 8 of those we're trying to start. And in the future, we'll have a women's and children's. So
do you like question them, or how do you decide if someone is going to be an advisor?
Yeah, so they apply online or by calling me, and we bring them in for a really informal interview, and we get to meet them and see what their interests are. And we kind of place them. So we have seats on the council, but we also have e-advisors. So if somebody says, you know, I don't really have time to come into a meeting, but I want to give back to Covenant, we say, well, how about being an e-advisor? And we'll send them maybe some marketing materials we're thinking about doing, or just some fast feedback type stuff, and they give us feedback that way. But it's a monthly meeting generally. It's a 1-year commitment. We do appreciate the team building aspect of it and having that routineness of it. So.
Wow. Is this something that's happening around the country now? Do you know?
Yeah, absolutely. So with the Affordable Care Act and everything going on, hospitals are really trying to engage their patients to make healthcare better. Again, being proactive versus reactive. So right now, actually, about 86% of hospitals in Michigan have an advisory council, and I'm proud to say that we were one of the first.
Great. So once again, if you want to be on the advisory council, please give Kristen a call, because she'll hook you up. She'll give you an interview, see what we can do there. All right, now you can catch Medical Moments every Wednesday morning right here on TV5 News at 9 a.m.